Well, there's an important concept in medicine that relates to many other aspects of life. If you don't use it, you lose it. It's been shown that if one has a body part, immobilizes it, even if it has normal nerve control, it'll get atrophic and lose its function. Years ago, people following heart attacks were placed at bed rest for weeks, and after that they'd had a hard time getting up, whereas now they're mobilized soon after the heart attack and they have much faster recovery. Well, after severe disabling conditions that cause paralysis, people are not moving. Their muscles can get atrophic and they suffer many serious side effects of the deconditioning, such as loss of calcium from their bones, problems with circulation, and depression. And when a limb is shortened, not only does it just shorten, but the blood vessels are shortened, the muscle will shorten, the nerves will shorten, and the joint will shorten. So it's much harder later to bring it out again. And sometimes it's even possible, even with surgery. I've been very excited about how the inventor of this machine has listened to professionals, physicians, and therapists about the kind of patterns that appear to be helpful to facilitate recovery, and these are reproduced with the machine. You can see how moving a limb through motions helps the body get attention, where a limb is moved through patterned motions passively. Reciprocal motion and crossed patterns is that patients can start off with passive exercise, and then as things improve, they're able to get somewhat more control. They can work with the movements where they wouldn't be able to lift the limb against gravity alone. They can use whatever muscle power they have and work through the movements, or as they get stronger, even resist the movements and build strength of the muscle's antagonist or opposite of the motion. In therapy with crawling with children with cerebral palsy, and this reciprocal motion seems to operate at a subcortical level to help enhance those pathways. And if we've talked about the control can be achieved at a lower level and ultimately higher levels in the brain. If the limb's not used, the brain doesn't recognize it, and it might sit there with the potential to be used but not be used. This reciprocal motion, these techniques are helping us use what's already there and help more people recover from spinal cord injury, brain injury, and head injury.